Now I'm going to begin the neurological exam. First, I'm going to have Mark walk in, and I'm going to note his gait, his posture, his tone, his stride, his arm movements. I see his gait is steady. Thank you. Have a seat for me. The neurological exam consists of 5 basic exams. Well, not basic, but 5 exams. You have your mental status. Mark, you know your name. Mark Mallory, you know where you are. What's today's date?
November 9th.
Yes, I know. Yeah, you haven't been at work. Okay, the 9th. So he's mentally stable, alert and oriented ×3, person, place, and time. His speech I will not be going over today, but normally a neurological exam involves a speech test. They do the cranial nerves, motor system, and sensory reflexes. Okay, so first I'm going to ask you, have you had any headaches, numbness, tingling, anything neurological going on?
No.
Okay, and I'm going to now assess the 12 cranial nerves, starting with the nose olfactory. I'm going to have you, normally this isn't checked in clinical practice, but for the purpose of this exam, we're going to check it. Let me have you close your eyes, occlude one nostril, put your finger up against one of your nostrils to close it. And I'm going to put this up to your left nostril, smell it, tell me what it is.
Cinnamon.
Okay, perfect. Close the other nostril with the other hand. And I'll put this up here, close your eyes for me, smell that, tell me what you smell.
Lavender.
Perfect. Okay. All right. Next, we go to cranial nerves 2 and 3, which involve the eyes. Normally, you would have a fundoscopic exam, and you would come in at a 15-degree angle. I forgot it. And I would look in there and look for his pupils to see if they're equal and reactive to light. I would be looking at the optic nerve and the optic disc. Next, I would do, that's the optic nerve, and then the ocular motor is his pupils constricting to light, consensual and non-consensual, if I had it. Next, I would do number 3, which is the 6 cardinal rules of gaze, which involves cranial nerves 3, 4, and 6. 4, the trochlear, 6, the abducens. And for the 6 cardinal rules of gaze, I'll have you open your eyes, follow my finger. Back to midline. Okay. And that covers nerves 3, 4, and 6. 4 is the trochlear, 6 is the abducens, and 3 is the ocular. So number 4 is the trochlear. Oh, we already did that. Number 5 is the trigeminal. So what I would do is check your trigeminal. Okay. Have you open and close your mouth? Okay. Clench your teeth. Smile for me. Puff out your cheeks. Okay. Next, I'm going to check your, because trigeminal involves both sensory and motor. So that was motor, now I'm going to do sensory. Let me have you close your eyes, and I'm going to rub something on your cheek, and you tell me if it's sharp or dull. Is that sharp or dull? Okay, and this?
Sharp.
Okay. That's checking the trigeminal. Next is 7, the facial. Let me have you smile. Smile's even. No sign of stroke where it would be crooked, one side would be leaning. Your acoustics would be hearing. I could do the whisper test. Let me have you close one of your ears. I'm going to whisper in your ear. What did I say?
Table.
Let me have you do this ear. What did I say?
Chair.
Okay, perfect. Next would be the glossopharyngeal. And let me have you swallow for me. Okay, and a lot of times that nerve can be affected if a patient had a stroke. That's why a lot of times patients have problems swallowing, because that nerve was affected for the stroke. Okay, next is the vagus. Let me check your pulses, your radio. Okay. Let me have you say ah. Okay. If I had my light, I'd be looking to make sure his uvula was midline, not deviated. Next, I'll check the accessory spinal. Let me have you push up against my shoulder, or against my hands. Push your shoulders up against my hands. Okay, and then down. Checking for resistance. Let me have you turn your face this way towards my hand. Okay, great. This way, turn again. All right, great. Last, that was the accessory spinal. Number 11. Number 12 is the 𝐓𝐇𝐈𝐒. Let me have you stick out your tongue. It's midline, there's no deviation. That concludes the cranial exam. Next is the motor function, which is part of the coordination. I already did that part when Mark walked in, and I noted his gait, and his tone is what's keeping him upright right now. Right now I'm looking at him for any tics, involuntary movements, rigidity, twitching. He's not flaccid like he was intubated, where you pick his hand up and it would just flop right back down. He able to control his movements. Next, I will move Mark's arms for passive range of motion. Okay, bigger muscles. Next, I will check strength, which is part of the muscle exam. Let me have you put your arms out, palms up. I'm going to put my hands and I'm trying to press down. Keep me from pressing down with your strength. Okay, turn them over. Keep me from pressing up. Okay, good. Checking for resistance. Put your fingers together like this. Don't let me open them. Good. Okay, open them up. Don't let me close them. Great. Okay, normal muscle strength. Okay, next, make a fist. Both hands. Okay, keep them up. Oh no, turn them this way. I'm sorry. Turn them this way. Keep them up. Okay, now see if I can. Don't let me press them down. Okay, yeah, that's right. You got it right. With your shoulders, with your elbows out. That's checking the shoulders with the fists up. Now let me move it up and down. And with the elbows out, that's flexion and extension, and abduction and adduction. Now I'm going to check your big muscles, which is your quadriceps, and I'm going to grab your ankles. Don't relax it. I'm going to try and pull it out like you had it. You work against me. Don't let me pull it out. Okay, good. Let me try this one. Okay, good. I'm going to try and push this back towards the table. Don't let me. Great strength. Okay, great strength. Okay, next, let me check your hips. Let me have you lie down. I'm going to try and push your legs open. Well, bend your knees for me. Both of them. Okay, I'm going to try and push your legs open. Don't let me. Okay, I'm trying to push them closed. Don't let me. Okay, I'm going to do flexion, extension. I'm checking your hips and rotation for abduction and adduction. Rotate it this way. Okay, fine. This one leg. This one. Okay, fine. Roll this one out that way. Okay, then the hip comes on this way. Okay. Now I'm going to have you do the Romberg test. Sorry, let me have you stand up again. Stand up, eyes open, arms out. No, straight ahead, I'm sorry. Arms out, palms up. Okay, now close your eyes and just stand there. What I'm looking for, I'm noticing that he's upright, he's not moving or swaying, so he's able to keep his balance with his eyes closed. Okay, now that's good, thanks. Now we're gonna do the pronator test. And the pronator test, close your eyes. Put your arms back out like you had them. Straight up with your palms up. Relax. See how his arms return to the same position that they were in when I hit them. If they were uneven, that would show that he's got a problem, a neurological problem, that his arms didn't come up to the exact position. This concludes the neurological coordination exam. The next is point movements. Let me have you touch my finger with your finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Okay, Mark's able to do this. Do it faster. Touch your nose, finger. Okay, that shows that that's normal. He has normal coordination and he doesn't have a brain stem injury. Now we're going to do the sensory portion. I need you to close your eyes. Okay, I'm going to check sharp and dull. What's that? Sharp or dull?
Sharp.
Okay. Next, I'm going to check. I'm going to put two different objects in your hand, and you tell me what they are. In your right hand, what does that feel like to you? What is that? Okay. And then in this hand, what's that feel like?
Q-tip.
Okay. Perfect. Thanks. Mark was able to distinguish the different objects I put in his hands. Next, we're going to call, that's called stereognosis. Next, we're going to check graphophagia. Let me have your hand marked. Eyes closed. I'm going to write a number on your hand. Tell me what number it is.
3.
Okay, let me have this hand.
5.
Perfect, okay. Next, we're going to do point localization. I'm going to have you close your eyes. I'm going to touch a part of your body, and you tell me where I touched.
Forearm. Leg. Shoulder. Chin.
Okay, perfect. Next, we're going to do 2-point localization. I'll use 2 earrings because I forgot my bobby pin. I'm going to touch you, and you're going to tell me if you feel one prick or 2.
1. 1. 2. 2. 1.
The hands are more sensitive, and you can feel better, or it's easier to feel it if the area is further apart than it would be on the legs. On the legs, it would have to be a lot further. It would be closer on the hands, and you could feel 2 pin pricks. And if I did it on his legs and had them the same distance, he probably would still only feel 1 prick. I would probably have to go out a little further in diameter because the extremities are further away for him to be able to differentiate 2 pinpoint sensations versus 1. Okay, next, let's see, deep tendon reflexes. Let me have you have a seat. First, I'm going to check your brachioradialis. And what happens is his thumb twitches as I hit that with the reflex. Next, I'll check his biceps tendon. Okay. Next, I will check his triceps. This part's kind of hard because it's hard for people to relax to do this. Try and let it relax for me. It would jerk a little bit, and sometimes you can feel the tricep muscle contracting, which I could feel a little bit. Then I would do this side, let it dangle for me. Okay. Next is the patella. When everybody's used to, let it relax for me. Looking for the soft part under the kneecap, the patella. Got a reflex jump. Try this one. What I'm aiming for is that little spot under the patella. Perfect. Normal reflexes. Which Achilles did you rupture, babe? That one. Okay, my husband has a ruptured Achilles, status post-ruptured Achilles, so I'm not going to check that one. I'll just check the right one, and I'll let it relax for me. Go behind the ankle, find the Achilles. Get a little jerk in motion with the foot. Next, I'm going to do the Babinski. Take the backhand of this and rub it up his foot. And plantar flexes, which is normal for an adult, where the toes go down, and for a kid they would go up. Let's see. Oh, and I'm also going to check for clonus. I'll use this foot because that foot has had surgery. Check, grab your ankle. And what I'm checking for is rigidity, spasms, or jerking. He does not have clonus. Okay. That concludes the deep tendon reflexes. Last, I'm going to do the cutaneous reflexes. Let me have you lay down, babe. Sorry, you got to expose your tummy. I'm going to take the Q-tip and start from the umbilicus and go upward. When people are very muscular or have a lot of adipose tissue, it's hard to see the little rippling or the twitching in the stomach. Next, I am going to check. I already did your Babinski. Your I think that's it. This concludes my neuromuscular exam. Thank you.